Before we start getting into this video, I just want to say thank you to healthjobs.co.uk for sponsoring this video. Go check them out if you're interested in doing any job within healthcare. So hi guys, my name is Rosie. I am a medical science student at the University of Leeds, but I also work as a healthcare assistant alongside my studies. And today I want to talk all about the career opportunities for a healthcare assistant. This is so relevant to me because I'm using being a healthcare assistant to get experience in terms of one day, hopefully, becoming a doctor. That is my really huge dream. It's what I'm working towards all the time. So I'm using a healthcare assistant role to hopefully gain enough experience to one day be able to call myself Dr. Rosie. And there are so many other career opportunities, so I thought I'd talk about them all. But yeah, healthcare assistant can be a lifelong career as well if you want it to be. I know so many people who've been a healthcare assistant for like 20-30 years and love it, so there's definitely that as well. I thought I'd actually go into what a healthcare assistant is. So a healthcare assistant is basically a patient's first point of call, especially if they are on like a ward. So I would be assigned certain patients for the day and they would come to me if they had any issues, and then if they're issues that I can't personally deal with, you raise it higher and higher to like nurses, doctors, anything in between. So the HCA does basically any kind of task that they are qualified to do so. So for me, that involves doing observations, chatting to patients, physical mews, helping with meals, helping wash patients, anything like that. It's really a really good job. I really do enjoy it. For me, it's something that I know I don't want to do for the rest of my life, but it's something that is so valuable to me right now, because for me, I never came from a family that has loads of medical experience. Like, none of my family work in direct healthcare, so I've got a few, like only a fair few like medical like shadowing experiences, and for like a future medic you need lots of those kind of experiences. So I find working as a healthcare assistant really opens the door to all these kind of opportunities. So I've got to know doctors, senior nurses, senior staff in hospitals that will give me these opportunities because I work on their wards. So that has been just invaluable to me personally, because I've had all these different opportunities, such as shadowing staff, such as meeting patients with all these different like presentations and being part of their multidisciplinary team to help form their kind of treatment plan and care plan and like stick to that. And I think that is just incredible and really an empowering part of the job. So I would definitely say that has probably been the most rewarding part of being a healthcare assistant. But there are so many different avenues you can go to. So a healthcare assistant literally works in the most variety of places. They can be, you know, NHS wards, private sectors, GP surgeries, prisons, schools, literally anywhere. You can have things, and these all can lead on to different roles. So the first one, which I think is probably one of the most obvious ones, is that a lot of healthcare assistants are like student nurses, or they're aiming to become a nurse and trying to get experience. So you could definitely do that if you're thinking, if like you're a uni student like me and you're thinking, hey, you might want to go into nursing or be one of the like shift coordinators. Getting this kind of like first-hand direct patient experience, it's really useful. So that is definitely one job you can go into. You could go in to be like an allied health professional, such as like a cardiac physiologist, anything, an occupational therapist. There are so many roles out there that you could be a radiographer. And I find for me, like shadowing patients who are sometimes in a spinal ward with like patients with MS, or in a psychiatric ward with patients with like postpartum psychosis, the day can vary so much and you get so much experience and you really find out what you want to do. And that's what I love. It's like a starting block if you want to utilize the job that way. is a real like starting place for all these different jobs that you can possibly go into. So I'm finding out, basically I'm using my healthcare assistant role to find out what kind of specialty I want to go into. So like I said, I've worked on spinal wards, I've worked on children's wards, on mental health wards, on A&E. I've literally worked absolutely, like, I'm getting the broad spectrum of it, and that's what I like, because I can form all these different connections with every single person out there, and get such a wide array of experience. And for me, that helps me so much in my studies as well as a medical scientist, because I get to witness all these different conditions and all these different patient presentations, and helps me form like a bedside manner with patients that people who haven't had the job experience might not necessarily have. So that is another reason why I would become a HCA if you are watching this video and want that kind of experience. Another avenue you can go into is management. Every hospital has a manager, and normally they're people who have progressed from that ward themselves. That's what the majority of the wards I have worked on have been like volunteers, staff, anyone who's kind of known to the ward can progress up when there's a job that becomes available if they've got like the qualifications. And having this like first-hand experience on a ward really puts you like up for that kind of role. So if you are interested in management and running wards and keeping up with all the like administration tasks, I would definitely recommend starting off as a healthcare assistant. If you don't have a lot of experience in the field, I would definitely do that, because then you can always progress upwards towards management and running the then team of healthcare assistants. Then there's always, obviously, the course that I study is medical sciences, which you can be like a biomedical science on an NHS ward in the labs. Lab work is literally like so needed right now as well. So there's definitely that kind of pathway up. You get like real world patient contact in this as well. Then there's physician's associate roles. There's such a broad like spectrum of places you can go within a HCA role, and I think that is why so many people come to the role, to see what doors it can open for them. Because when I wanted to like really become a doctor, that's when I really started like looking for these kind of roles, and I'm so glad I got one, which was actually through a recruitment agency as well. I think being a healthcare worker, like a healthcare assistant, has literally changed my life and really inspired me to know that I want to become a doctor. It literally, every day I like work alongside doctors and I'm like, wow, I really want to be you. I love my job, but this is what I want to work towards. And hearing people's stories, especially when like I ask people like what they've done before, like I would say a good 80% of people said, oh yeah, I was a support worker and now I'm this, or I'm a support worker and I love it and I want to stay in this role for years. And that is what I think is lovely about the NHS, is that people absolutely are so passionate about their jobs, and that's why they come into work, and it is just such a like rewarding experience to be a worker in the NHS, especially during these times right now. So I would say if you are wanting to go into healthcare, definitely start as a healthcare assistant, definitely get experience on the wards. It is absolutely great. And so if you are looking to get a job, why not check out healthjobs.co.uk. They've got a whole job board of all different jobs going right now, including healthcare assistant roles. Thank you so much for watching this video. I really do appreciate it. If you haven't already, like, comment and subscribe, and I will see you next time.